Number 4 is visual memory. Visual memory is the ability to make mental pictures and form and hold these visual images in our mind for later use. Symptoms of poor visual memory include poor spelling, difficulty decoding, and/or poor comprehension. Visual memory, or the ability to make mental pictures, is vital in the process of reading for both word recognition and comprehension. Each word has its own unique shape, which the student must immediately recognize as he is reading. If a student has good visual memory, he is able to recall a word after several exposures to that word. A student with poor visual memory may require 40 to 50 exposures to a word before he can readily recognize and read the word. Consequently, he learns to read, but at a much slower rate. Also, as we are reading, we must put words and phrases together to conceptualize meaning. If we can see pictures in our mind, or we can form a clear mental picture of what is taking place in the text as we are reading, we can conceptualize meaning. We even use this skill in math. If we can visualize the step-by-step procedure as a math concept is being explained, we can more easily understand and recall the procedure for later use. The following exercise can be used to assess a student's visual memory. This assessment is for ages 9 through adults. For this activity, we will be using a strip of 6 letters. Some of the letters are uppercase and some are lowercase letters. The letters should be arranged so that there are no words or patterns in the strip. The number of letters used would depend on the age of the student. Students aging 9 through 11 would do 5 letters per strip. Ages 12 and above would do 6 letters per strip. The student will count slowly from 1 through 12 out loud while looking at the letter strip. Notice that the student will continue counting, saying 11, 12 after the strip is taken away. The exercise would look like this.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12.
What were the first 2 letters on the strip?
U and A.
Which was uppercase?
U.
Okay, what were the last 2 letters on the strip?
R and W.
And what was the lowercase letter?
R.
Can you remember one other uppercase letter?
H.
Good. You would ask the student to recall the letters on the strip out of order. The student would also be required to tell you whether the letters were uppercase or lowercase. The inability to accurately recall the letters, the letter positions, and whether the letters were uppercase or lowercase is a strong indication of poor visual memory. After a few minutes of instruction and practice, the student should be able to recall the visual features of each letter strip.